Hi, this is Adrian from Mental Talk, and this is our kind of first video podcast. And we have Aileen Apuli. She is a therapist in Oak Park, Illinois, and we're going to have a casual chat about pandemic, COVID-19, how's everybody shaping up, opening up in Chicago and Illinois, and just a whole host of things. So welcome to Mental Talk. Thanks. Hi.
Hi, Adrian. Nice to be here. Thank you for having me.
Thank you for coming on to our little podcast. We're doing something a little different. Normally we have a podcast, audio, and we want to test the waters a little bit and have one for our YouTube channel as well. So welcome
Thank you.
to your seat. So I just want to share with everybody, tell us a little bit about what you do as a therapist.
So I am an outpatient therapist in Oak Park. I range from seeing youth to adults of all ages. So right now, the youngest child that I see is 8 years old. The eldest that I have right now in my caseload is in their 50s. With that, I do individual, couples, and family therapy as well.
Oh, great. And as you know, we're Step Up for Mental Health, and we are a peer organization, and we help families dealing with all types of things right now. Our helpline is through the roof. We're a peer-led organization, but we partner a lot with therapists and making sure people get the services and support they need, whether it's for us one-on-one, but then if people need to move out and move into therapy, we kind of refer. And so cool stuff. So I appreciate you as what you're doing. So tell us, we're talking about COVID. I like to say COVID, but it's COVID, COVID-19.
COVID-19.
I know, COVID-19. And I want to talk about, a lot of people are kind of scared. We've been seeing a lot of, in our helpline, anxiety, depression. People are really scared. We're getting a lot of calls from seniors, which is one of our demographics. We love helping seniors. And so in your practice is working with families and children, that kind of thing. What things have you been seeing, generally that's been happening in Illinois?
I would say personally in my work, what I've seen is a lot of grief. There hasn't been a week where I haven't had a client lose someone personally to them. And right now it's increased. In the beginning, I had one passing away every week. The most I had last week was 3. Not necessarily, it's split between COVID and not COVID related, but majority is the elderly. So I have youth that are losing their grandparents for the first time. So along with that is with the pandemic restrictions we have on funeral services. So it's unfortunate that not everyone has that opportunity to experience the funeral service in the wake. So as a youth, there is the death of my grandparent, but also not having to be able to see them or understand what's going on, assuming that it is the pandemic, when there are pre-existing conditions. So grief has been pretty severe on my end.
It kind of reminds me, I'm a little older, so it kind of reminds me with my grandmother. I loved my grandmother, so I can't understand what children are going through. Back in the day, children weren't allowed to be in the hospital. So I could never say goodbye. I was 12 years old, couldn't say goodbye. And to me, I think that's the most devastating thing. So I can't even imagine where people are able to see their grandparents in different settings. And now all of a sudden, children are not allowed to do it.
Right. And in the hospitals too. I mean, that we're not allowed any guests or visitors. I've experienced a client with her daughter in a car accident, and she hasn't been able to see her in the hospital. What they told her was, unless she's, unless she passes away to approve the body, I'm trying to think of like a formal way to say that, like committed to be deceased. It's just been really heavy. At the same time, it's kind of working with them has helped me like reflect on my own personal like my own personal experiences when it comes to like my grandparents.
Mhm.
So right now I only have one grandparent. She's 96. She lives in an assisted nursing home,
Mhm.
and before we were sheltering in place, they were already like, you're not even coming anywhere near that. So it's allowed me to, you know, check in on her a lot more than usual, finding creative ways to be engaged with her because staff can't talk to her. She can't really talk to other people. So my concern is her mental health and not being depressed because she's so used to having family over every week.
Mhm.
So I've done Zoom calls with her, and you know, 96 on an iPad trying to like look through a screen, even if she's able to stay focused for 15 minutes, I don't need her there for a whole hour. Completely fine. So yeah. So in a way, yeah, my work has also helped me be reflective of my own personal life.
Have you felt like, I mean, I do a lot of peer, support facilitation. We had we've been getting things, like I said, older people, seniors want to talk to someone. And then we do things a lot on, online. We can help people. I did my first house visit, not, we're not visiting, but we helped somebody who was disabled, needed some essential things and
Mm-hmm.
emergency food. So one of the things I've noticed in kind of like a nursing home, assistant living things, that they're on lockdown right now in Illinois. So we have homeless shelters, we have nursing homes, and we have group homes that put, people with special needs. They're all on lockdown, and we've been hearing a lot of things where they're having a hard time processing that they can't go out or can't do it. They can't
Right.
even walk around the area facility like freedom. So have you seen a lot of that where families talking about how they're stressed and how their loved ones are stressed in that way?
Mm-hmm. I would say in the beginning, it was hard for her to understand. Like she thought it was just her that was under this lockdown. And she's like, well, at least you guys can go out and and I was like, no, I'm working from home right now. Um, but she understands now, but definitely that transition um, was a challenge for her. And I think it's important, like you said, to check in on our elders, talking to them, right? Keeping them company. They can't physically be with someone right now, right? We see a lot in the news of like couples being separated from each other in the nursing homes, not being able to visit and just visiting through windows. So yeah, take initiative to, yeah, take a phone call. Really does go a long way.
Yeah, I mean, now, we have, we get a lot of that kind of too. Sometimes people want to do videos for us when we do
Mm-hmm.
peer support and phone calls. Younger people want to do SMS, DMs, text message. And so, now I'm so happy we have these technologies that people can still, I know it's not the same, but I think it's a
Yes.
little comfort. Um,
Right.
we have a girlfriend group that I go to that we used to do brunch twice every 2 months. And so we are now doing, kind of video conferencing and just kind of like talking about what's happening or talking about good news or things like that. So I think those type of tools go a long way with families, I think.
Yeah, I agree.
So let's talk about a little bit about, you know, the opening of cities,
Mm.
a lot of way. Well, excuse me. I want to talk about, I got to get something. I'm having a little cough.
Oh, you're fine.
So let's talk about what is the families thinking about? Because I know everybody is scared about, economic issues, that kind of thing. But we still are seeing the numbers kind of rise up a little bit. I'm always looking at Chicago's website. I get like text messages all the time. I need to know. Some people don't want to know. I'm a
Yeah.
person who wants to know the data, and I see a lot of things. I know when we had an episode where it was sunny. It was 71 degrees, I think 2 weeks
Mm-hmm.
ago.
Yes. Oh, yes.
Yeah, and everyone were, kind of mad. And
Yes.
in our
Much more
neighborhood,
when the summer comes.
yeah, I'm at 60639 area code, and I'm just gonna tell you, our area code is they said it's the largest hit of COVID, which I'm kind of stressed about.
Hmm.
And so with that, everybody's kind of hyper active. They want to be outside, but then we have parties and that kind of thing. So now I feel like the numbers are coming up. I think and that's going to be a correlation related to that.
Mm-hmm.
What are you feeling about families with as far as jobs, as far as being outside, as far as being, kind of getting fresh air? Are they really stressed out about that, or other
Yeah.
issues?
Um, when it comes to my work with them, I very much instill a bit of just like my personal views without being direct, because I do understand the need. Everyone has this need for things to go back to normal.
Yeah.
And I tell them, like, unfortunately, things will not go back to that normal. It's the new normal now.
Yeah.
Like, the virus it still exists. And although things are lifted, we still have to treat these practices within our own. Like, no one is telling us to shelter in place once this is lifted, but we need to be more mindful of our interactions when we are on the playground, when we're going to restaurants and bars. Still, precautions and keeping at a safe distance.
Are there more anxiety about the next steps? Maybe a lot of people have restaurants, or a lot of people have small businesses, or a lot of people are on the front line, middle class families, doing all the type of jobs that is public facing,
Yeah,
retail, post
right.
office, that kind of stuff.
Yeah, I mean, it's honestly mixed. I've seen a range of like 20 to 30-year-olds telling me, I'm just ready for this to be over with. Like, I'm over it already. And I'm like, okay, what do you mean you're over it? I'm like, I just need to get out the house. Okay, what is the first place you're going to that you're so eager to get out the house? I just need to go to a bar or restaurant. And that's when I go to explaining to them, just like you said, people really either disregard the news, filter the news, but don't really understand how much at risk they are to others. So it's one thing, you as a young person getting the virus, but being a carrier to your elders and parents, asymptomatic.
Yeah.
So I find myself kind of like filtering that for them because they're ignorant to watch the news. So that's for one.
Yeah, because I guess young people right now, they're not really watching the current news, like as far as like television. Most young people are on their phones, and
Mm-hmm.
they're getting news from now it's TikTok. I'm on TikTok,
Yeah,
Facebook, Instagram, that kind of thing. So
right.
so they're
And
getting bite-sized information. They're not getting full
yeah,
stories about it.
and the people that are passing away isn't within their age range, right? It's their elders and adults, but they need to understand the concept of them being a carrier.
Yeah.
And then another thing too is then like people not taking it seriously until the point when they lose someone.
Mhm.
Um, that's also part of that generation as well.
Yeah, I mean, I'm just kind of worried because every time we see somebody, Wisconsin, for example, and Wisconsin is kitty corner to Illinois. It's not like this pandemic virus is not going to just stop at the border. People come in and out all the time from Indiana, from Wisconsin, from Michigan, that kind of thing, and so I just find when I go out, I go out and take my doggy Larrabee.
Yeah.
And I have my mask. We finally it took us a month and a half to get these masks to come in. We had we were supposed to have 4 and 2 didn't show up. So somebody made me, we were quarantined for 20 days because we didn't know about my husband.
Mm-hmm.
Some neighbors came in and brought us 2 masks. So he has those now. We cleaned them. He has those, and I got the 2 that came in that was mine. For some reason, his didn't show up. And so people still look at me. It's kind of weird. Like they look at me like, because I see a lot of people not with their masks, and then they look guilty or something. And I shame you. I mean, people, stop shaming me. I'm like, no, I'm a
Yeah.
demographic. I'm a person of color. for one.
Right.
So I'm the most likely to get. I'm like not. Sadly, I need to lose some weight, and so I'm one of the demographics. My husband is type 1 diabetic.
Mm-hmm.
He's suffering from health issues right now. So I can't get it because he will, he'll get sick and he's,
Right.
so we are on the front line as people who are most likely to get it. So we've been really safe. I was just shocked that I was so happy that I was negative, but I was like, I didn't know I did everything I could do. I was so careful. So
Yeah.
I was like, well, anybody can get it. We know that one of our neighbors, maybe they said they had all the symptoms and they were coughing for like 2 months. So we thought,
Yeah.
okay, maybe, my husband got it, touching the railings or something, going down the stairs or something. But I was shocked. I was like, okay, I don't have it. So then they said, well, stay home. They said I had a flu. I had basically like a bad cold, kind of like flu, like regular thing. They said, but so they
Right.
told me to stay home for 3 days, just to make sure I'm okay. We ended up. I just stayed home for 20. I really did. We had stocked up food, and then
Yeah.
after that, now we had to take the dog out really quickly. But I'm really careful about being around people. I see somebody, I always go like in a different direction. So
Yeah.
like I said, I see people literally looking at me like, because I got the mask, and then they feel guilty. Because one guy came out the car today, he had no mask on in the car. I understand, but then he kind of like looked at me, and I just like, I gave him a little shade, and then all of a sudden he's walking, and he had his little, his paper mask on. I just like, okay, I still walked.
Okay.
Wait, I still walked. Me and Larry kind of walked over a little bit,
Yeah.
but I shouldn't have to like look at you and you feel guilty.
Mm-hmm.
This is my take. They don't know what's going on. They don't know, really everything about this virus.
Right.
There's no vaccine. They're saying, this is going to be like a year and a half still.
Right.
Why not?
Even if they were to have a vaccine or treatment, there is the testing to see what the long-term effects, if there's any aftermath, like consequences, side effects to what we inject in ourselves.
Right. So why not wear masks? I just feel like I wish the city would just say, it doesn't matter if it's 6 feet distancing or not. Just wear a mask. You go
Yeah.
outside, wear a
Right.
mask. That way, easy peasy, it's safe.
Yeah.
It's safer.
Right. And I do understand, like, people are uncomfortable. Like, the kids tell me, well, it feels weird, but you know what? Like, this is part of the new norm now,
I
right?
will.
I know it's scary, but we have to.
Yeah, I will say that I got the mask. I wish I had brought it with me, but I got the mask with the pocket of. They came with 4 filters that last like five uses.
Oh, okay. Yeah. And you like
So,
replace it on the inside?
yeah, and
Yeah.
I will say, because I didn't have that before, it got used. I had to get used to breathing through the filter because I feel
Okay.
like when I was walking up the stairs, that maybe I just need to work out.
Mm-hmm. Or,
But
well, you said you have asthma,
no,
right?
I don't have asthma. I
No?
have fibromyalgia,
Oh, okay.
and
Yeah.
I need to lose some weight. That's what that is. But I also, they said I might have. My doctor said I might have breathing problems, which is sleep
Okay.
sleep apnea. I
Sleep
can't say the
apnea.
word.
Mm-hmm.
Yeah. So that could be something too. But I did find out the filter. It was a little bit, uh,
Because it's
hard to
thicker.
breathe, just a little
Mm-hmm.
bit, not that bad. But now I'm used to it. But I think it's better. I don't know how long I'm going to use it, but after that it's gone. Maybe I'll get something from the Home Depot or something and get like a filter thing and just kind of put it, slip it, make it squares. They say make some
Okay.
squares and put them in.
Yeah, that works out.
Yeah. So you say the new normal. We talked about the new normal. What do you think it's going to look like? As just,
Mm.
overall, are we just going to always be thinking about hand washing? Is this going to bring up more anxiety and OCD regarding being clean? I do
Yeah.
find myself mentally stressing out about cleanliness.
I mean, uh, yes. I mean, yes, anxiety and paranoia has definitely increased, which is why all we can do is take control of what we can, right? I don't know what's going on the outside, but I can control it by taking care of myself, washing my hands, being mindful of others by wearing my mask.
Hmm.
So doing my due diligence of that for myself.
Hmm.
Um, one thing not believing in it, but I am trying to have other people understand, that concept of other people around you, though.
Yeah.
Um,
I think that's smart. So just take us out on a positive note. Tell us, some techniques that we as human beings, as people trying to calm ourselves down. But what thing do you recommend? Excuse me, I'm gonna cut that. Wow. We can cut that.
You're fine.
Okay. That was so good too. Okay. To take ourselves out of, on a positive note, uh, talk about what things we can do as individuals to keep calm, be mindful of everyone, ourselves, and each other, but be positive and be in a, think about positivity to make our mental health better.
Yeah. Since I've been preaching in the beginning before this started, and like even just going back to the basics, right now we're sheltered in place, but we still have the outside, our backyards, the outdoors around us. So really take advantage of taking a walk outside, taking your dog out for a walk, having your children take a break from the video games, the screen time of e-learning,
Mhm.
really just a mental break to change your environment outside of being sheltered in the home, because it is taking a toll on us mentally. All of us, we're all human, right? When we're isolated in our thoughts with COVID, that depression, anxiety increases. So what are we doing to change that? I know it's hard to change that routine because it doesn't feel safe outside, but do that for yourself, even if it's for a half hour of your day.
Mhm.
Um, those moments when we do get a tease of 70-degree weather, we're not all going to go out to the lake. Nope. But like I said, we have a porch, a backyard. Um, yeah. So outdoors for one. Checking in on each other, I think,
Mhm.
is really important. We assume that everyone's okay, and everyone is not okay. Let's be honest. No one is okay right now. Everyone has absolutely been affected in some way, whether personally, in their family, in their work. So checking in on each other. Uh, I know it may seem like you're alone, but we're all in this together. So taking advantage of the resources like Step Up for Mental Health that's here for you, therapists like myself that are providing that support. We have our crisis hotlines, throughout the state. So utilizing that.
Yeah, I think so. And we have resources, just so everybody knows. If you go to stepupformentalhealth.org, you'll see our resources that you can check out. You can always go to our helpline on the page. I think it's what we do. And underneath that is the helpline support. So I want to thank you so much for joining us. I know we're experimenting. We're doing some really cool stuff. Our biggest thing is happening right now, just to take off on a positive note, is we have a lot of online things, events, and we've been doing. I know a little sign language, and so we're partnering with Gallaudet Universities. They're free service, and
Mm-hmm.
we are learning some more sign language. It's not a class; it's a workshop because we're all learning, and that's been fun. People have been really enjoying that. So
Okay.
like you said, think about things that's gonna bring you joy. Go outside, watch with your little fur baby, and everything is going to get better, I think. And thank you so much for joining us.
Yes. Thank you for having me, Adrian.